the Global Resilient Cities Network to this webinar. In the week since we connected last, the number of cases globally has skyrocketed, which is reinforcing that we are in the midst of perhaps the resilience challenge of our time with COVID-19. All around us, cities are rapidly mobilizing to support systems and manage through. Sharing experiences between trusted colleagues empowers everyone from leaders to citizens to feel prepared. And we're very grateful to the World Bank team for co-convening this series with us. And tonight to our two very qualified speakers, Fernando Straface and Michael Berkowitz, for joining us, and they will speak on local responses to combat COVID-19. Before I hand off the microphone to Barjor to introduce the speakers, I want to remind everyone of the intention and the ground rules of the conversation today. The purpose of these global webinars is to have open and honest learning conversations between practitioners in cities and governments and partners who are working hard to support those entities. These calls are not on the record, and we ask that you attribute any comments made today or the questions asked to the speakers only if you have contacted that person and have their express permission to do so. We are really thrilled at the response to this webinar. Over 600 people registered to attend this call globally. And to facilitate this discussion, as a matter of practicality, we ask that you use the Q&A function, not the chat function, but the Q&A function to log your questions during the Q&A time. So thank you again for joining us, and over to you, Barjor.
Yeah, thank you very much, and welcome everybody to this webinar. Just for your information, I'm based in Beijing. I'm sitting in Beijing on the 3rd Ring Road, and traffic is almost back to normal. So hang in there, everything will get back to normal. Have patience, wash your hands, and follow the rules that your local governments lay out for you. So let me go straight in and introduce the two excellent speakers that we have today. First, we will have a presentation by Fernando Straface. He's the Secretary General and the Secretary of Foreign Relations of the government of the city of Buenos Aires. And he has been responsible for assisting the mayor in organizing and coordinating the government's strategic priorities, managing the federal and institutional relations, and leading Buenos Aires in the international projection strategy. And he has a long experience in good governance, public sector reform, civil society, both in Argentina and internationally. And he has been an executive director of a leading Argentinian think tank, and has also worked with the Inter-American Development Bank across 14 Latin American countries. Next speaker he's based in New York, and he is now part of the Office of Emergency Management of the City of New York. So he's right in the middle of what we see on our television screens these days. But he has also been one of the founding members. I mean, he was there at the Rockefeller Foundation to shape and oversee the creation of the 100 resilient cities. And he has headed the global operational risk management of Deutsche Bank. So here we have two very experienced and very knowledgeable speakers, and I'll now hand it over to Fernando to start his presentation. Thank you.
Good night. Here is 9:30, so 9:30 p.m. And I'm very happy to join this global conversation. Thank you, Lauren. Thank you, Barjor, and my good friend, Michael. I'm here to share with you what in fact is a work in progress, because we are entering in the most difficult phase on the pandemic. And my goal with you is to share how we have been able to prepare the city and the health capacity of the city to approach that moment. Now I'm going to share the screen and to share with you a presentation I have. Yes, there we are. I hope you are all looking at it. Let me see if it's working. Of course, it's not advancing. Let me see. Just wait a minute for me. There we go. Okay. My presentation is divided in 4 sections. First, I describe the current situation in Argentina. The fact that we are a latecomer to the pandemic gave us some time, and we are using that time to prepare. Then I'll share with you the timeline we are projecting for the future. Probably the core of my presentation is section 3, where I will share how we were able to organize, reorganize, redefine the government in order to approach the worst case of the worst phase of the pandemic. And we're already starting to think about the day after. We know that's still ahead. We pass a lot of time before we get into that possibility. But since we are able to learn from other cities, we created already a team in the city that it's thinking about and planning the day after. To begin with, I will briefly introduce the current epidemiological situation in Argentina and in Buenos Aires. Just for you to have an idea, we are a city of 3 million people sleeping in the city, but we are surrounded by a metropolitan area of other 14 million people. So every day in Buenos Aires, in a normal day, you have around between 6 and 7 million people working, studying, visiting, commuting in the city. And in terms of the epidemiological situation, in Argentina, we have more than 1,000 confirmed cases. 321 of them are residents of the city of Buenos Aires. So we have more than 1/3 of the people in the country, in the whole country, with the virus, and 60% of them belong to the metropolitan area of Buenos Aires. And here you have a comparison between with the number of days in that went from the case of the first day up to date. Okay, phases and timeline. In only 14 days, the government of the city of Buenos Aires has already been through these 4 phases: containment, social distancing, shutdown, and lockdown. We have implemented more than 70 measures, including restricting mobility, promoting home office, providing online courses for students, strengthening our healthcare system, taking care of our senior citizens, and enforcing a mandatory quarantine, among many others. It's important to share with you that most of the decisions regarding the shutdown and the lockdown of the city has been taken by the federal government. Argentina is a federal country with 3 different levels of government: the national, the states, and the municipalities. And the city of Buenos Aires is a combination of both the responsibilities of a municipality plus the responsibilities of a state government. We are responsible for education, for health. We have our own security system, our own justice system. So we have all the functions of a state, but in the case of declaring the shutdown and the initial lockdown, it was a national decision, and it was a very early one that was taken by the federal government. We think that was a successful measure because of so far we've been able to do the famous thing of flattening the curve, and that gave us time, the city and the rest of the states in the country, to prepare for the more difficult phase coming ahead. Here you have a relative perspective of the measures that I just described, comparing to some other countries. And here you can really see the benefits of being a latecomer, to learn from the others and to prepare accordingly. You are seeing how, if we even compare, for example, to the case of China or to the case of Madrid, of course, New York is another case to learn, the measures that we were able to take in the very early moments since the first case were very advanced comparing to other countries. And I point to the -4 moment. -4 means that 4 days before even the first case appeared, imported case appeared in the city of Buenos Aires, the mayor was doing a press conference announcing that that was going to happen someday. We really didn't know at that time, and we started prepare accordingly. At that time, the mayor was, if you want, in a way, accused from some people of being too drastic in the press conference, but 4 days after, the reality proved that he was right. Now, let's turn to how we adapted the government and the city to the crisis. While Buenos Aires has developed robust emergency responses strategies, such as the resilience strategy, this is a black swan, something that we didn't expect. And so, like every city, our challenge was to prepare ourselves and adapt rapidly in this new scenario. Our new priority became the containment of the outbreak and guaranteeing the safety of all our citizens. Consequently, we had to align the entire government behind this common objective, reorient and reassign resources, and design effective evidence-based policies. Why we were able to adapt to this situation, we are reflecting. First, because we are, if you want, in a continuous of the administration of the city for now 13 years, and the city in that time has implemented a rigorous policy-making process with strong planning and monitoring methodologies. We took advantage of that to redefine the main goal of the government and how we will organize to take that goal. So I'm going to describe right now how we actually reorganize the government to function in the middle of the pandemic. We decided to define 3 strategic areas in axis of management, as we call it in the presentation. First, half of the government is going to work in what we call the crisis management front. Then we have I will say 40% of the government working in the other functions of the government that you can stop because they are still running. And we have a specific group, as I mentioned before, working in the day after of the pandemic. We know that reality is not going to be the same after the pandemic, and we want to be prepared with new policies and hopefully the best processes to come back as soon as possible to something like normal life. I'll focus now on the crisis management area of the government. This is composed of several working groups, such as essential services, communication, security, among others, all of which report to a strategic policy working group that meets daily every morning. I belong to that group with the mayor, the vice mayor, the minister of health of the city, and the people from the communication unit, and we meet every day, 8 a.m. o'clock, to monitor the health strategy in the city and to meet with the several other groups that you are seeing in the slide to be informed and to make decisions on the course of the strategy. I also have to, I will also like to mention that from the strategic policy working group, we define actors outside the government with whom we want to meet and with whom we want to exchange information. For example, actors from the private sector or the civil society. In terms of the health strategy and the health working group, as I mentioned before, we aim to anticipate further outbreaks and put in place what is now globally called a suppression strategy, which involve obligatory quarantine to slow down the curve, early identification, and the isolation of older people. The isolation of older people, it's probably the last one of the measures, the policies that we implemented, and actually we will announce it in public tomorrow. And tomorrow we're starting an operation that we know is being replicated in other countries, but not in the early stage that we are going to do it. Just to give you a very intuitive idea, we are going to work with 3 different groups of elderly people to isolate them. First, the elderly people that live in their own houses with other members of the family. We will give to them protocols on how to isolate themselves inside their houses. The second group is the elderly people that live without any extra member of the family. We will help them with a specific program supported by volunteers that will support them in their daily life, with logistics, with buying food, with buying medicines, with calling them to see how they are doing with the isolation. And the third group is probably the most the most related to a medium poor country like Argentina, is the group of people that elderly people that live in very vulnerable areas, places where they have no place to isolate with the family because of the density of people that live in the household. For them, we will organize a specific policy of inviting them to isolate in hotels and other specific places that were defined for them to live the next couple of weeks. Nobody knows for how long. The reason why we do that, this whole policy, isolation of older people, are of 2 reasons. First, I don't have to explain, they are the most vulnerable group to the virus. Secondly, they are the people that usually contribute to collapse the health systems here and almost in every place of the world. And then, if you are already thinking about the day after of the pandemic, now we know, we are able to learn, we were lucky to learn, that this is the most important group to isolate if you want to open in different phases the rest of the society and the rest of the economy. If you are going to put other people in the streets, first you have to make sure that you were able to isolate the elderly people. I can come back to this because I think it's a very an innovative approach that Buenos Aires is taking, and I'm happy to continue that conversation. Then I have a couple of slides with numbers that I'm sure you are able to see in other cities, how we prepare the health system for a new um, quantity and type of demand. And we divided the, the system in 3 different levels. The intensive care units, we are working in more than doubling the number of beds on that. Then we increase the hospital beds for those patients that need a medium intensive type of treatment. And again, since Buenos Aires is a very cosmopolitan city and we are lucky to have quite a few hotels, we enter into an agreement with the hotels of the city for them to receive the majority of the patients that have a mild condition, but you don't want them to stay either at their homes because of the risk of transmitting the virus to their family, and you don't want them to use hospital beds that are more important for more critical patients. So this policy of the hotels, we also think is a very innovative approach. A policy that we have already used for people, Argentines, that came from abroad, from different countries, especially from the countries in risk, that were coming back to the country, as it happened in many other countries, and they were posing a risk for the rest of the society because nobody knew if they had the virus or not, because but it was a risk to leave them freely in the city, carrying the virus, some of them. So we already tried this policy for around 2,700 repatriated Argentines that have been in quarantine, I will say in the last 2 weeks in hotels in the city. Not an easy task, to receive a fellow citizen in the international airport and to tell him or her that they have to go to a hotel to live for the next 14 days in a room. I can come back to that too. We complemented the health infrastructure with some other elements that some other cities are using too, including the WhatsApp instrument for diagnosis. We have a special line, telephone line in the city for people to communicate, but it was collapsing. So we developed with the teams of the city, a Body City WhatsApp that is used to diagnosing symptoms and to refer to a medical practitioner when the citizen meets some criteria. And I finished the health strategy by mentioning that the city of Buenos Aires has a very an additional challenge, which is not to plan only the provision of health services for the citizens of the city, but also for the demand from the metropolitan area of Buenos Aires, which is the area, the orange area surrounding the city of Buenos Aires that you are looking at in the slide, with interjurisdictional challenges included, because all the different boundaries you see in the picture are different municipalities in the province of Buenos Aires, and each of them has a mayor, has a political affiliation, and is related to a state government of the province of Buenos Aires. So just to make it simple, you have in the metropolitan area of Buenos Aires 4 different levels of government interacting: the federal government, the city of Buenos Aires, each of the municipalities, and the state government of the province of Buenos Aires. And that coordination is a real challenge that we are being able to approach, but it's also a threshold for coordination that is important to meet. I'll change to some other of the essential services that are part of the global strategy. Education, as is happening in every country, went to the houses and the households and the families. So the city was able to use some of the planning that had already in place now for providing almost the whole services. Luckily, we had been investing in teachers training in technology. We had 100% of the classrooms already connected to the internet, and also with personal computers for the children of the public school system of Buenos Aires. Just to make a clarification, in the city you have 50% of the system, of the education system, run by the private sector and 50% by public schools. We also created a group of life at home, which means basically what you do while you are at home and you are not helping your kids to educate or working from home. What you do with your free time, how you are able to have a distraction and other activities that make your life easier during this time. This group is headed by the Minister of Culture of the city. And just to make it simple, we created a platform. I don't know if the website is there, where you have more than 60 type of cultural digital content and entertainment available. For example, all the programming of the Opera House of Buenos Aires, the Teatro Colón, is now available for free in that platform. And we are inviting artists and influencers from the city to produce content to put to go public in this platform. And I have to say that it's been with great success that we are doing that. And finally, I'd like to mention the important role of a communication strategy in all of this. We knew from the beginning that we wanted to be ahead of events as far as we can. So the idea of the mayor doing a regular press conference, usually very early in the morning, just to have the news cycle running, it was a very important one. And I will say that we do press conference every 2 days, and sometimes it's not the mayor, but one of the ministers in charge of some of the groups that I mentioned before. Of course, Twitter it's also an instrument, but during the press conference, we try to be very precise, almost always with the truth, and trying to anticipate what's going to happen, including, for example, I remember a couple of days ago when we said, the mayor said in advance, that the mayor told the people in advance that there was going to be social circulation of the virus when the news cycle was only stuck in what we call the imported cases. That at that moment was not easy because it was kind of a change of the game, but it was a great heads up for the people and for other actors, including to sustain some of the measures that at that time were perceived as too strict. So that was a support for those measures. We did a couple of meetings with the largest companies of the city with a very specific agenda. If I can share a lesson with colleagues from other practitioners from the world, is that in the middle of in the worst moment of the pandemic, you will see a lot of people and institutions and organizations coming to you, the government with the willingness to help, and it is very important that the government is able to organize that energy. Otherwise, you don't end up doing anything concrete, or they put the effort in the wrong cause. So when we call the largest companies and NGOs of the city, we define a very precise agenda of what we were expecting from them, or which were the most important fronts in which they could contribute. And last slide, probably is like science fiction today because of the moment Buenos Aires is, but we're already planning in the sequence and the elements of what we call a switch on agenda, how the city is going to switch on again someday, and what we have to do in advance to prepare the city for that. And if I have to choose or to mention one of the points that is there, I think one of the most important is preparing specific protocols for the main sectors of the city. Life will come back, but it will come back different from what it was. So we need a protocol for restaurants, for the cinemas, for the theaters, for the life in the public domain. So we are already exchanging protocols with other people, with other cities, and we are already consulting and engaging in a dialogue with the private sector on how those protocols are going to look and what are going to be the new demands for them to meet those protocols. Thank you very much.
Thank you so much, Fernando. The presentation you just offered is an example of why we do these calls. You shared so openly and so completely about the strategy from Buenos Aires, and I can already see that there are a number of questions that are going to come up around the specificity, around how you're working on the isolation of the elderly, the efforts around life at home, which has generated a lot of interest, as well as how we link the private sector effectively. Before we go to those questions, I want to turn the floor over to my friend and former colleague, the former president of 100 Resilient Cities, Michael Berkowitz, who's now back to the Office of Emergency Management for a secondment. If you can talk to us, Michael, about what's going on in New York now, how this mobilization and response maybe is similar in some ways, but different in other ways than what you would have experienced before. Thank you for being with us.
Yeah, great. And thank you, Lauren, for inviting me. And it's great to see so many friends and family on the video, and my friend Fernando Straface. It's great to see you as well. I just want to call it out to make sure no one missed it. I think Fernando said the Teatro Colón, their entire archive is available for free to anyone. So I feel like that's really news you can use in these times. So thank you for a great resource. So yes, just to give my background, right, with many of the people on this call, was involved in the 100 Resilient Cities over the last 6 years, trying to help cities build urban resilience. And as some of you may know, earlier this year, with some colleagues from 100 RC, we founded the Resilient Cities Catalyst to, with many of you, take that work forward even still. But many, many years ago, as Lauren alluded to, between 1998 and 2005, I was the Deputy Commissioner of Emergency Management in New York City. And so a couple of weeks ago, I got a call from the Office of Emergency Management, the agency that's charged in New York City with coordinating interagency responses. Sometimes you call it civil defense or crisis management, but this is the interagency function. They called to say, would you come back and spend some time to help through this crisis? And so I'll talk a little bit about that work, which is really around a particular supporting food and emergency food distribution. And I've been really trying to connect that to the work that we did at 100 Resilient Cities, and that the Global Resilient Cities Network and others are doing now, which is helping cities think about their problems and opportunities in more holistic ways, and what the fabric of the community means to a response like this. And we heard a lot of those aspects in Fernando's presentation. But just first, maybe to level set, because I don't entirely know the geography of the people who are on, but New York City is a huge and centralized city, probably one of the biggest, wealthiest, and most centralized cities in the world. So it's 8 million residents at night, more than that during the day, an annual budget of $90 billion between capital and operational, a workforce of 300 and 350,000, and incredibly active city government. And yet, as Fernando was describing in Buenos Aires, so many different layers go into the kind of response that is needed during a big crisis like this. You have the national level government, of course, the state. Many of you will have seen the governor on, and then there's the mayor. But even more importantly, are all of the other organizations, nonprofits, community-based organizations, and the private sector that make up this response. And so I've been consistently reminded over my couple of weeks working around this food issue of the importance of that. So what am I doing? Right now, I am not doing anything related to the technical health response. I'm doing no case management, no surge capacity for hospitals, no mass fatality planning, none of the things that many other cities and that Fernando described as going on in Argentina. I'm not responsible for that. I'm going to talk very specifically about emergency food. When New York, like many other cities, instituted strict and aggressive social distancing measures, including what Fernando referred to as lockdown, we knew that we needed to find ways to get food to our most vulnerable residents. And there is this intersection between health vulnerability and food vulnerability. Whether you're health vulnerable because you're a senior or because you have an underlying medical condition, and you're food vulnerable either because of persistent poverty that was there even before the crisis, or because of new poverty and vulnerability because of the crisis, you need to have food available either through delivery or by picking it up somewhere. And those who are health vulnerable, for sure, shouldn't leave their homes and should stay at home. And so we've been really thinking about what all of those aspects are and how to identify those at-risk groups and to meet their needs in the best possible ways. And so maybe because this is really about, this session is really about ramping up, I just give you a few lessons that I've seen emerging, and please take these somewhat with a grain of salt. They're 2 weeks into a crisis that could last months, and so I hope, Lauren, you'll have me back, in 3 months, and maybe my tune will have changed somewhat. But I'll tell you some of the sort of things that have been bubbling around in my head as it relates to this crisis, but also to the things that we are trying to do building urban resilience. So the first is you need to lean on the existing processes and organizations that have been providing this to begin with. When we're at 100 Resilient Cities and the GRCN and Resilient Cities Catalyst, we have stressed how cities can build cohesive, robust communities where neighbors check on neighbors, that have strong community-based organizations. And we've seen in New York, and I'm sure this is true in Buenos Aires and many of your cities around the world, the importance of these organizations as we go through. These are the organizations that can most easily help and assist the vulnerable populations, whether they're stuck in their homes and need food delivered, or have other issues like needing to get medicine or other services. If you wait for a centralized city government to do that, it's very much harder. And so building on and supporting those local organizations and institutions is something that's incredibly important. And this mayor in New York City, Mayor de Blasio, and this administration did prioritize community-based organizations and nonprofits when it came in, did it through its resilience strategy called One New York, but in many other things after that. And you can really see that beginning to pay dividends. Those organizations are stretched and they will need lots of support, but for sure, building on those processes and not trying to reinvent the wheel, super important going forward. The second thing I would say is, and I'd be interested to see if this is happening in other cities, but expanding the portfolio and repurposing high capacity leaders from within city government is something that I've been very impressed with here. So the mayor appointed Catherine Garcia, she's had a number of different jobs, both in this administration and the previous one, as the food czar. Her day job is the commissioner of sanitation, which actually has a lot of overlap with food because they're running composting and food waste programs and so on. But she is responsible for end-to-end, soup to nuts, if you'll excuse the food pun, the food, looking at food issues throughout this crisis, from food supply all the way to emergency feeding, and ultimately, as we get into recovery, trying to work with the local restaurants and food producers and organizations to jumpstart those. And we've seen it be incredibly effective. Food lived in lots of different places in New York City government before this, and centralizing it under one really dynamic, high capacity leader like Catherine Garcia in this case has been really great. The third lesson I would say is have a plan for surge. And the way, and this did not exist when I was at New York City Office of Emergency Management 15 years ago. But what they did was they had contracts in place with third-party vendors to bring in new leaders and workers like me through third-party contracts. They had a plan for how a relatively small city agency could staff up at a time of crisis. And they've implemented that, and other city agencies have done similar things. And so this plan to ramp up to a capacity that's necessary for such an all-encompassing, protracted kind of crisis like the pandemic, I think has been really smart and something that I wish was in place when I was there during 9/11 and other crises. So I think having that plan for how you get up to the staffing level that's necessary has been really important. And then my last lesson, or thought maybe, is that, and I said it before, but that this is what resilience looks like. That the strong community-based we are going to break transmission one day soon. As Fernando said, we're going to need to switch back on. But when we do, we are going to wake up to communities that have been impacted by the pandemic. We'll have death and disease, of course, and that will be incredibly tragic, and we'll have economic damage from the shutdown and the distancing. And so this is when we are going to need the things that we've talked about, and I'm just looking at my friend Lauren here on the screen, that we've been talking about for the last 6 years. It's like, it's not just about infrastructure or about governance. It's about all of those things. It's about having those communities that are strong, that will create places for people to go and feel safe, and places for them to get help, because our poor and vulnerable are going to be poorer and more vulnerable when we're through the acute phase of this pandemic And so this is why we talk about resilience in a holistic way. And I feel stronger than ever that is the right approach. So with that, I will say thank you and look forward to your questions.
Thank you, Michael. I think the lessons that you were just sharing are so practical for everyone in terms of contextualizing what it looks like when a system and a city is able to respond with resilience. And going to the questions now, building on those systems and also the idea of repurposing those high capacity leaders in cities are two really interesting themes that you brought out. And in Fernando, in your presentation, when you talk about those three axes and repurposing people within the city to do the work, really come up. In the questions, we're seeing a couple of tactical questions related to those themes around how you really mobilize something like the Life at Home program. How does that come about? How does that happen? And then related to the food security issue, how are those populations mapped and targeted? And what are the best ways to really initiate those kinds of responses in, you know, a data-driven and measurable way? So I'll open it to you, Fernando. I don't know if you'd like to respond first, and then we'll go back to Michael. You're muted. We can't hear you yet.
Now we go. I'll go first with the question on the Life at Home group. First, the intuition behind that group. Buenos Aires is a city with a high cultural capacity and identity. And because we are in the pandemic and we are all at home, that doesn't mean that we have to shut down culture in the city. That was the intuition behind the policy, which was the big question of how are we able to transform the provision of cultural services, both the one provided by the government and the rich cultural life of the city, in a way that arrives to the homes of the people in the city without the physical facilities in place. And the first thing that we did was to call the private and not for-profit sector, cultural sectors in the city, to come up with ideas. Then the government led the programming process and the venues to do that. We have a TV channel of the city, we have a specific radio of the city, and then is the web. And the idea behind that was that the cultural machine of the city was not going to stop because the city was physically locking down. So that was the intuition behind, and then if you want the supply create its own demand, because we have everyday channels and venues to communicate the programming of the day and specific activities that are like icons of each night. For example, the functions of the Colón Theater. That is all run and led by the Minister of Culture of the city. He has a council from the private sector that assists him. And once every 2 days, they come to the strategic meeting at the city for questions, for policy decisions, for budgets sometimes to do things. So I will say the main issue is that the Life at Home group is at the same level of importance, of the health strategy. It's part of the life of the people in the city while we are in the middle of this pandemic.
Yeah,
Thank you, Fernando.
And very quickly to respond to the question about how are we identifying the vulnerable communities. I think it's a really interesting one, and it's interesting for this reason, is that we have a very good handle on where the vulnerable communities are before the pandemic. We have good databases that serve as either, identifiers or really as proxies for where the vulnerability is, whether that's through our, Department for the Aging or our Department of Social Services or Human Resource Administration. I mean, we have good data on where people are vulnerable either because of age or other health reasons or because of income. But what we're thinking about now is what is the speed at which that's going to change during this incident? And I don't know, for those of you from other countries, you may be aware that in the US generally, the last two unemployment filing periods set records, massive, record-shattering numbers of new people seeking unemployment assistance. And so particularly in a city as varied as New York, you will see a lot of that vulnerability rise to the surface. And so the question has been, how do we account for that? And how do we begin to understand how those various vulnerabilities are interacting and expanding and growing over the life of this crisis? New York has a single front door into the city services, a single call number called 311, and a single website. And so that's one way, an important but limited way of gathering that data. And the other is to much more closely and in real time work with the agencies and the nonprofit organizations that service these communities on a day-to-day basis and understand how we think that vulnerability is changing throughout the crisis. So it's a great question. It's something we've been talking about all the time, but there are no, I don't have a particularly simple answer, but rather that we're working on it in a very integrated, multi-agency and organization kind of way.
And Fernando, did you want to add to that as well?
Actually, Patricia, I wanted to jump to a very specific question that Patricia Hachilla asked, which is a very important one because it's a challenge still for us. The question is, in terms of isolating older people, any civil rights concern? She asks, and yes, there are a lot of concerns, and it's still a question that we haven't been able to fully answer. The question is, does the government has the right to force older people to isolate? And probably not. So the formula which we have arrived is that we are advising very strongly to older people to isolate in these different levels that I was mentioning. And probably the trickiest one is the one related to the vulnerable people that we have to invite to go someplace else, but it's not compulsory. If at the end of the day they don't want, the government is not going to force them. But that's why the communication strategy is so important, and the role of the media and the influencers. It's an advice both to protect them and to protect the rest of the society.
Thank you, Fernando. That was a fantastic reminder about the role of communications and influencers and these social reinforcing mechanisms, not just these hard measures to help to keep these isolation measures to be more humane and more effective. The question I want to pose next is related to how we know when we can start to initiate these switch on moments, I think, to use the Buenos Aires phrasing. And this is a question that's gotten a lot of attention here in the chat. And so specifically, how do we know when it's the right time to start to initiate these measures? What are those public health measures that we're using to determine how and when it's safe to open up certain sectors and prepare for those switch on moments?
In the case of Buenos Aires, in our strategy, we are envisioning that we will be able to start to switch on the day that we have certainty that our health system is going to have enough capacity to for the cases that is going to receive. At this moment, we are uncertain on that capacity because we still haven't entered the worst phase of the pandemic. And we are shutting down and we are all locked down because we are buying time to prepare. Once the worst scenario starts, we will have real measures of the capacity of our health system to deal with the dynamics of the pandemic. At some moment, we will be able to have some certainty. That will be the time when, combining that kind of enough capacity to deal with the isolation of the most vulnerable people, with the capacity to test and then to isolate those and the surrounding people to those with the virus, then will be the time to start thinking about new protocols to slowly and progressively come back to the new normal life.
Okay, maybe I'd answer that slightly also with a different focus, which is I think, you know, public health people will tell us when that's the right time. But I think we should think about, what do we do when that happens? Because that time will come and we will have an opportunity to rebuild our lives and communities and societies in ways that are more just and equitable, sustainable, and ultimately more resilient. And that's going to take some doing. Will be an incredible opportunity there. But one of the things we've seen looking at communities that have been impacted by disasters all over the world, from Hurricane Katrina in New Orleans to the Christchurch earthquakes, to the Puerto Rico hurricane and so on, you have this amazing opportunity after a disaster to do something transformational. And yet it's always the hardest time to do that because you just want to get back to normalcy, get back to the way things were. And so one of the things that this group, this community could really begin to think about is, how do we use this opportunity when that happens to make ourselves into a better, more livable place? And that's how I begin to think about that question.
Thanks, Michael. And I think that's a really great way to start to move towards our wrap up. And for this part, I am going to say that I'll ask both of you this question on the record. This is the beginning, and there is a massive conversation that needs to continue to happen between practitioners, between cities, about how we manage through this and get to resilience. I've seen a number of questions and comments asking that we bring both of you back in the series of webinars to continue to talk about switching on, to continue to talk about building resilience. And so I will say on the record that let's do that. I hope you can both also commit to join us again. And I would also say that in the context of all of this, it was not an accident to bring cities of New York and Buenos Aires together on a call. You know, when you talk about the metro areas, when you talk about being cultural icons, I think we are going to move towards a new normal, and there will be these opportunities to build better. What it means to be part of a city and associate with that city is actually now becoming global. If you think of people wearing I Love New York t-shirts and hats all around the world, or tuning in to Teatro Colón from their living room in Singapore, I think there's a tremendous opportunity to show how we support cities and how they continue to be the places that we want to meet and we want to convene in the best ways possible. So I think this has been a tremendously rich conversation. We will be making the presentation from Fernando, notes from the session, and the recordings available. We'll also convene again next week. I want to remind everyone this is a weekly speaker series.
We lost you, Lauren.
We lost her.
It's just you and me, Michael.
No, Nini, can you take over, Nini? Hi, Nini.
We can hear you, Barger.
Yeah, I think Singapore, everybody in Singapore is on Zoom right now, I think. Anyway, so let me jump in and say really thank you very much to both of you and to everybody who's participated. And we look forward to having you both again after all of this is done, and hopefully in better circumstances, and we'll have learned a lot by then. And thank you everybody, and we hope to we look forward to seeing you all next week. So thank you very much.
Thank you, Barger. Thank you to the World Bank and the GRCN. And nice to see you, Fernando.
Nice to see you, Michael, and thank you to all the participants.